Welcome to another edition of The Takedown, a series of candid interviews about tobacco use and advocacy within communities most impacted by big tobacco's tactics. Dr. Patricia Nez Henderson is the incoming president of the Society for Research on Tobacco and Nicotine. Welcome, Dr. Nez Henderson. It's such a pleasure to speak with you today.
Thank you. Thank you so much for the introduction. Yate, zitlatnin shlon totsoni bashishchin chenjikin dashanala ashe dashiche kuda sando amado zaitlinin shle. My welcome in my own language, the Navajo language, and I'd first like to give acknowledgement to the land on which I live, work, and play, the land of the Lakota people. The background of my background in this talk is actually Haysapa, which is a very, very sacred place for the Lakota people and other tribes. So I just want to make sure I make that land acknowledgement.
Yes, thank you. And again, welcome. So let's jump into today's questions. You just had an incredible win as the Navajo Nation Council passed smoke-free legislation. This bill prohibits the use of commercial tobacco products in all indoor public spaces and workspaces, including in casinos across the Navajo Nation. Can you share a little bit why this bill was so important and the challenges advocates faced in getting this bill passed?
Oh my goodness! Well, this story started, or the process started over 14 years ago, and then 13 years ago was the first time that the advocates, tried to pass a policy that would prohibit the use of commercial tobacco products in all public places and workplaces. And then 2009. And then tried again in 2011, and then an initiative drive in 2018. So in the past 13 years, a lot has happened. And so, my goodness, this past, the Era's Life Act, the Era's Life Act of 2021 was so monumental. In many, many ways, because I think the fundamental reason is we just had so much support from the community. When I say we, I'm talking about the coalition as well as my colleagues, scientists who have and healthcare providers and health professionals who really worked out there to educate our Navajo leaders about the impact of commercial tobacco use, and then educating our community members on the differences on commercial and ceremonial use, actually. So because of colonization, and I just want to probably preface that by what I'm going to say, because of colonization, the tobacco industry basically took a plant that was very sacred, mass produced it, and then put it in the hands of our Navajo children. Right. And today we have high rates of e-cig use among our Navajo people, among our Navajo youth. And our effort as a coalition was to decolonize tobacco. We want to reclaim what was sacred, and we all did it with the help of the traditional healers. And this was the unique thing. They came behind this effort and say, we support this effort. We know through all the education that we've done over the past 15 years, they're like, yeah, we totally support you. So when the legislation went before Navajo Nation Council, their support, the traditional healer support, the support of former elected leaders, the youth, the healthcare providers, national organizations, it's just local organizations, the states. It was just incredible just to get that support from folks and feel like you weren't the only one that was doing this by yourself. And so when on October 19th, when Navajo Nation passed it, we just were elated with joy. We're like, this is historic. We celebrate it. We're like, this is really exciting. And we know that the president of Navajo Nation still needs to sign it into law, but we will celebrate this wonderful win. And then by the Sunday, we should know whether or not this law is, or this legislation is, or this bill is passed or is enacted. into law or whether it gets vetoed. So we're hoping for it to be enacted into law.
I know you mentioned a little bit about the difference, or started to talk a little bit about the difference of traditional sacred tobacco and commercial tobacco. And you've worked a lot to raise awareness of the distinction between the two. Because one thing that we do know is many Indigenous communities use sacred tobacco for medicinal and ceremonial purposes as part of their tradition and culture. Can you tell us a little bit more about this important distinction and the advocacy work that you've done a little bit more around this distinction of commercial and sacred tobacco?
Absolutely. In many Indigenous communities, not only here in the United States, but in Canada, Central America, and going all the way down to South America, use nicotina plants for ceremonial purposes. We know that. And then other tribes use other forms of plants for their ceremonies, like here in the Black Hills. The Lakota tribes use different types of plants, right? But on Navajo Nation, though, we use Tzitlanto. It's a small, tiny nicotina plant that is found indigenously throughout those areas. And then they had been using it for such a long time, as long as, I guess, as long as we can go back. I mean, for eternity. And then policies were passed by the federal government, basically to ban all forms of practices by the Indigenous peoples. And in doing so, they also banned the use of plants, including tzitlat, of these ceremonial plants. So over the years, this kind of created an environment where commercial tobacco products became normal within our communities. It became normalized. And so now we had to go back into the communities that we came from and re-educate our traditional healers about the differences. And that literally, with Navajo Nation anyway, it literally took from, I want to say from 2005 to, gosh, probably 2012, 13, for it to finally click, like, oh, wow, this really has impacted our ceremonies, and what do we do? And yeah, so it's been a lot of hard work. I mean, this happened over a period of over 100 plus years, right? So it took several years to kind of just re-educate our traditional healers about this. But once they did it, they got the message. It's just, they felt empowered, and we're like, okay, we're going after the tobacco industry. Like we're going to reclaim what is ours.
One thing that we do know is smoking rates for commercial tobacco are higher in the Indigenous community than for any other racial ethnic subgroup. Why is it important to create culturally relevant prevention and cessation materials?
I think for us to even get to developing these interventions, we have to kind of look at the history of what the industry has done. They use colonistic strategies to introduce products that are so deadly to our communities. And that history is very, very important. It's very important for our communities to realize this, that, you know, that this industry came willingly into our communities and basically funded scholarships to our communities, paid for rodeo sponsors. You know, they did so much, rodeos, powwows. They were kind of just in there, right? They normalized the use of commercial tobacco products within our communities without really telling us the true history of what had happened and why, you know, what their real intent was. And I think providing that type of education to our communities is really, really important, especially for our youth. You know, our youth have one of the highest rates of smoking in the country. But they need to understand that these strategies that were used by the industry was the industry was very, very specific. They knew who they wanted to hook. And they did that in a way that was so conniving, I guess, in my own words. But to expose them in that way is important. And that's when the cultural relevant things come in, like really integrating that history with the use of ceremonial tobacco and really helping our youth, primarily our youth, understand like there is a big difference. One product is very harmful and the other is very sacred. And how do we educate them on this? How do we educate our individuals who are wanting to quit smoking as well? And using strategies that are culturally relevant are very important. And using our own methods of like mindfulness, and that has been integrated in our communities for such a long time. And we know that mindfulness works for cessation. So that's what we're working for, or that's what we're doing right now, is developing interventions that really use these strategies. So I'm really excited. I think in the next 10 years, we're going to make just a lot of significant contribution to the literature in terms of a scientist, that is, I'm speaking, but also in terms of the advocacy efforts. That our tribes are looking at each other, wondering like, okay, who's going to do what? And I think Navajo Nation's just, I'm hoping that they're one of the first to really have a comprehensive policy that addresses this, especially for our casinos.
As with other minority populations, the tobacco industry, as you mentioned, strategically targets the Indigenous community and co-ops, your culture and promotes brands like Natural American Spirits. How do we counter these types of tobacco industry tactics?
Call them out. Those are racist tactics that they're using. It is all about social justice, right? And equity within our community, like what we can do on our end, and letting the industry know like this, we can't allow this anymore. And I think with everything that has happened over the past 2 years in our communities throughout United States and now throughout the world, we know that we can do something about it. And I think just calling them out, like those tactics are very racist and it hurts our communities, and please stop, is a strategy that we're wanting to do. And that's where the whole efforts of decolonization is just really letting folks know, like individuals know, these strategies that have been used by the industry are no longer acceptable. We will not accept it anymore. Our children will not accept it anymore. And I think just empowering folks, our Indigenous people, to know that they have this role, they have this voice to do that is very encouraging. I believe we're doing it now.
So what policy and environmental changes are needed to truly reduce tobacco-related disparities among Indigenous communities?
I can think of it at different levels for me. When you ask me that question, there's the level at the federal level, the state level, tribal level, community level, and then as we call it, the Hogan level. All these addictions that are, particularly with nicotine addiction, right, among our people, it was because of what the federal government has done over the years. And I think before we can move forward in any efforts in healing the soul of Indigenous populations, we need to address that about our past, about what the history is. And I think Canada has done that. New Zealand, Australia is just really recognizing the truth, understanding the truth, speaking that truth, and then reconciliation happens afterwards, right? And recognizing like, okay, like we can make steps to amend what has happened to what has happened to our Indigenous communities. And I'm just kind of looking at that right now of what other countries have done, and then they've done it very well. And I think that is going to make significant changes for us down at the Hogan level, to know that our leadership in Washington, D.C. are really I guess that what they say is really within their hearts. I guess that's at the federal level, and then at the state is just, and at the tribal level too, for us to understand like this, that it is a nicotine addiction. At the same time, saying that though is recognizing also like this is a sacred plant. And one of our traditional healers, I really like what he said. He picked up a pack of cigarettes and he said, the spirit of this plant was good. It had good intentions, and then the industry just messed that up. So I think it's reclaiming that, right? And I think it's going to take a lot of work, and I believe that our Indigenous communities are already at that level, and it's just really, really awesome to see that, that we're really wanting to make a change within our communities. So I think it's just all these partnerships that I'm kind of thinking of with collaboration with the federal government. When I say federal government, of course, I'm thinking of CDC and NIH, the FDA, all these organizations that are dealing with health, and then the states, and then our federally recognized tribes, or state recognized tribes, and then of course down into the communities. And I think one thing that people don't really understand is that relationship between federally recognized tribes and the federal government. They need to be looked at as a political agreement. It's a political agreement between two sovereign nations. And I think that's what tribes have been wanting all along, is to be looked at as a sovereign nation. And so, and this is really exciting, because what has happened in states 15 years ago, tribes are now finally implementing these things in terms of tobacco policies with funding from the federal government. So I think funding is going to be a big component to the work that needs to happen. And then a lot of education, a lot of advocacy, a lot of support from non-Indigenous communities or non-Indigenous organization is going to be key to making this work and getting the tobacco industry out of our communities.
So in closing, could you tell us a little bit more about the Navajo Nation's philosophy and how we can embody this philosophy in our efforts to prevent and reduce the use of commercial tobacco products?
Absolutely. In the Navajo philosophy, there's several key words that I can think of when you ask that question. Hujon. Hujon, I guess if I were to interpret it into the English language, is in balance or in harmony. And then these are the principles that we live by on the Navajo Nation, right? We're guided by these principles of love and compassion and respect. And I think when you combine these two, the philosophy and the word Hujon together, and Hujon together, it creates like this environment where we respect everybody, where we respect one another. When we bring this principle along with Hujon together, and which is clanship, right? Three things. It just makes sense that we would want to create an environment that is commercial tobacco free for everybody, not just for myself, not just for my family, not just for my community, but for the nation as a whole. It just makes sense, and I think our traditional healers have known this. They live by this philosophy. And just going through this process over the past 15 years with the nation, I'm reminded of that all the time. And it guides me on my daily action, is that like, okay, I just need to make sure that not only am I protecting myself from the harms that are out there, but that I'm bringing into my life things that are good for my mind, body, and spirit. And that's going to impact everything around me. I have this thing that I was shared with by a traditional healer. He said, and when I were to translate that into the English language, it means that commercial tobacco products not only harms the inner essence of who you are, but everything around you. And that's what the industry has done. They've created this environment that is totally not in balance. And our role now is to bring it back to balance and calling them out for what they have done to our communities and empowering our communities to know, I guess, empowering them to know that they can create change and create a healthier environment for the moms. And I always have to say this, for the moms to be, because those are the people that are going to be bringing in the new generation, for the dads to be. We're thinking generations and generations down the road. And if we create these policies now, it has a long-term impact. And I believe we're going to see that with our Indigenous communities.